Hi, my name is Stephanie Terrell, Mercy Fairfield Orthopedic RN Navigator. I am here to help you get ready for your total shoulder or reverse total shoulder replacement surgery. I'm sure you have a lot of questions, and hopefully this class will teach you a few things. But if you should have any questions after this presentation, please feel free to reach out to me. My email and my phone number are listed below. All right, so before we get started, we are going to talk about our mission, our values, and our promise. So here at Mercy Health, we extend the healing ministry of Jesus by improving the health of our communities with the emphasis on people who are poor and underserved. Our values are compassion, excellence, human dignity, justice, sacredness of life, and service. Our promise to you is to make lives better with mind, body, and spirit, and to genuinely enjoy being of service. We would love to make your healthcare easier. So, what are some goals of our class? Well, we hope to educate the process of your toe joint surgery for you and your family and help decrease you and your family's anxiety. We want to help prepare you for your upcoming surgery and go over all the expectations during your hospital stay and help give you tips to help prepare your home for when you return. Now, as with having any major surgery, there's always risk of having a complication such as bleeding, infection, blood clots, and pneumonia. And we'll go over all these things and what you can do and what we can do to help prevent these things. We just want to make sure you have the best outcome possible so you have a very successful surgery. So our approach to your care. We utilize a team approach to the care of our patients before and after surgery. We realize each patient's unique, and we work to individualize our approach to your care so we can meet your needs and expectations during the entire surgical experience. We utilize a team approach to help you achieve your goals after surgery and maximize the quality outcomes you expect. We are here to help you at every stage of the surgical journey, so please don't hesitate to ask any of our team members with any questions you may have. You wouldn't be having the surgery if you didn't have a lot of pain, stiffness, mobility, and strength issues in your shoulder. So our goal is to get you back on your journey to good health with your new shoulder. We have a large, highly trained team that will be taking care of you before and after surgery. So these team members include, of course, your orthopedic surgeon. Now, under your orthopedic surgeon, you may also be working with a physician assistant or nurse practitioner. You will be working with two anesthesia providers, a anesthesiologist physician and a CRNA, a certified registered nurse anesthetist. We have also a very large operating room staff. So you'll be meeting with nurses, surgical assistants, and then the recovery room team. Now, if you have another health condition that needs to be managed while you're here in the hospital, we may consult additional physician services. So you may see more than just your surgeon. So, for example, if you have diabetes, we may have a hospitalist manage your conditions. Or if you have heart issues, you may see a cardiologist, that kind of thing. Now, some of our total shoulder replacement patients do work with physical therapy and occupational therapy, but not always. Sometimes your surgeon may not recommend therapy for several weeks after surgery. Of course, you will be working with nursing staff and patient care assistants while you're here in the hospital. You'll also be working with your nurse navigator and your discharge planners. Those are your social workers. And then you'll also be working with your auxiliary staff such as dietary, radiology, and laboratory techs. We have divided the class into three different parts. Your preoperative phase, so everything before surgery, your operative or inpatient phase, that's everything that happens at the hospital, and your discharge recovery phase, that's everything after surgery. So let's get started and talk about our preoperative phase. This is what you will need to do prior to having surgery. One thing we know for sure about having total joint replacement surgery is that you will need help. So please arrange for help after surgery. After surgery, you won't be able to drive until your doctor or therapist clears you. This can be anywhere from 2 weeks to 4 weeks or longer. So please plan to have a ride to your first post-op visit. Also, we encourage you to ask family members or friends to help deliver groceries and help you run errands. Now, if you do live alone, it would be a really good idea to have someone be available to stay with you for a few days or longer after surgery until you're ready to be on your own. Again, it's a good idea to plan this stuff now so you have less to worry about after your surgery. I did want to offer some suggestions on how to prepare your home for your upcoming surgery. Most likely, you will be wearing a sling or an immobilizer for the first few weeks of your recovery, maybe even longer. I recommend removing all tripping hazards such as electrical and telephone cords away from the walkways and remove throw bugs or put skid-resistant backing on them. We also recommend replacing worn stair treads, installing stable handrails, and using chairs with armrests. I will tell you, most of my patients really love their recliners after surgery. One, it's easier to sleep with your head elevated and your arms supported. And two, it's also easier to get in and out of the recliner because you have the armrest to push yourself off with the non-surgical arm. I also recommend avoiding low surface chairs and sofas, and make sure that you always have a phone within easy reach in your recovery, and make sure you keep your hallways brightly lit. Here are suggestions on how to prepare your bedroom and bathroom before surgery. In your bedroom, have a lamp and a phone within reach of your bed, and keep a clear path from the bedroom to the bathroom since that's going to be a frequent trip you make. When you get ready for bed, have your pain medication at bedside with hydration available for the night, just in case you need it. We also recommend purchasing or owning several loose-fitting t-shirts and pants with elastic waistbands to wear after recovery. These items will help make dressing easier, and it will be difficult to mess with buttons and zippers after surgery since you'll probably have limited movement to the surgical arm. In your bathroom, please install a non-slip mat. You may also want to consider purchasing a few other items just to make it easier to maneuver in your bathroom. For example, you may want to consider investing in a high-rise toilet seat, grab bar, shower chairs, a handheld shower head, a bidet attachment for your toilet, or a bottom buddy. Now, if you're unsure if you need these items, you can always ask your occupational therapist for recommendations. Insurance doesn't typically cover these items, but I have found these items to be cheaper at Amazon or in our local home improvement stores. Again, the goal is just to help prepare your home now so it's safe for you to return after surgery. A few other suggestions I have for you is to meal plan. It would be a really good idea to prepare some small, healthy meals ahead of time that can be easily reheated. I also recommend storing frequently used items at the waist level and less frequently used items in the higher cabinets, because after surgery you may not be able to reach those items in the higher cabinets. I also recommend to shop for foods that have protein in them and or fiber. First of all, protein helps with healing, and some of the pain medication that we prescribe after surgery causes constipation, and fiber usually helps with constipation. I usually recommend some sort of bran cereals, prunes, or some sort of fiber supplement. I do have a disclaimer that if you have a history of kidney disease, please do not increase your protein intake. Some of you may have already done this, but just in case you haven't or need a reminder, you do need to see your primary care physician within the 30 days before your surgery to help ensure that your medical conditions are well controlled and that it's safe to proceed with your surgery. We call this an H&P or history and physical visit. Now, you may also be required to see a specialist for an additional evaluation prior to surgery as well. For example, if you have heart issues, you may be referred to see a cardiologist for cardiac clearance. Your surgeon and or your primary care physician will help you with this. Pre-operative testing. Your surgeon has ordered for you to obtain a necessary lab and blood work done before your surgery. These labs are important because they will help us ensure that you are optimized medically in order to have the best surgical outcome. Your PAT nurse should discuss with you if you need additional tests such as an EKG to check your heart rhythm or COVID testing. Managing your medications. A pre-admission testing nurse or a PAT nurse has already conducted an interview with you to review your home medication regimen and give you instructions regarding your upcoming surgery. Please make sure you understand what medications you need to take the day of surgery and what medications you need to stop before surgery.
Here are some important medication reminders. All NSAIDs such as Motrin, Advil, Voltaren, Naproxen, Celebrex, Meloxicam, etc. need to be stopped 7 days before surgery unless you receive approval from your surgeon. It is okay to take Tylenol or acetaminophen. If you take any blood thinners or anticoagulants such as aspirin, Coumadin, Eliquis, Xarelto, Plavix, or etc., please ask your surgeon or prescribing physician for a stop date before your surgery just to make sure you can stop. We also ask that you stop all vitamin supplements such as vitamin E, fish oil, multivitamins, and any other herb supplements 7 days before surgery. If you have any questions, please call PAT at 513-870-7044.
It is very important to us that you do not get infection with your new total joint. So if you have a known bacteria present in your body at the time of surgery, it does increase the opportunity for the new implant to become infected. Please call your surgeon if you should have any significant changes in your health status before your surgery, such as a cold, fever, sore throat, flu-like symptoms, if you have a bladder infection, new diarrhea, new rashes, infected or ingrown toenails, inflamed gums or cavities, or new redness, swelling, or skin eruption infections. It would be better to postpone your surgery until you are healthy than to risk having your new implant get infected. Here's a few other tips to prevent infection. Of course, to quit smoking. It is very important to stop smoking before surgery, as smoking can cause the body to heal poorly and lead to a higher risk of complications, including infections and poor pain control. If you need assistance to quit smoking, please call the 1-800-QUIT-NOW for free support. Alcohol. We also ask that you eliminate or reduce alcohol intake prior to surgery. This will help in healing, and you cannot take any pain medication with alcohol. Nutrition. Just make sure that you're eating healthy meals. Getting enough protein and healthy foods before surgery will aid in healing and function after surgery. Make sure you drink lots of water up until the night before your surgery so that you stay hydrated. Also, washing your hands. Washing your hands frequently can help prevent the spread of infection. Let's talk about preoperative showering with HEPACLEANSE. HEPACLEANSE is a powerful disinfectant soap that will help make sure your skin is free of germs before surgery. This is very important because it helps prevent infection. You will use this soap as part of your shower regimen for a total of 5 showers before surgery. So you will need to shower daily starting 4 days before surgery, 3 days before surgery, 2 days before surgery, the day before surgery, and that 5th shower which will be on the day of surgery. And yes, if you have an early surgery start time, we do need you to wake up extra early to take this shower. It's very important. First, we ask that you use an antibacterial soap and a normal shampoo for your shower. Next, then use the HEPACLEANSE soap to wash your body with a clean washcloth each day. Please do not use the soap on your face, hair, or sensitive areas. Then you'll want to dry it with a freshly clean towel after each of those showers. On the morning of surgery, do not use hair products like hairspray or gel, and do not use lotions, powders, or creams on your skin after your last shower. Do not shave your surgical area within 96 hours of surgery, and change your bed linens and wear clean pajamas the night before surgery. On the morning of surgery, we want you to wear warm, clean clothes after your shower. We do ask you not to sleep with pets during the shower prep and avoid pets around your incision after surgery, as their pet dander can increase your risk of infection. Now, if you need a bottle of HEPACLEANSE, please call our PAT department at 513-870-7044, or you can pick some up at your local drugstore. Now, if you have an allergy to chlorhexidine, please call our PAT department for further instructions. When you are preparing for surgery, most people cannot have anything to eat or drink after midnight before their surgery, but some patients are allowed to drink Gatorade and fluids before surgery. So please follow your strict instructions that were given to you by your pre-admission testing department as to when you must stop drinking and eating before surgery. Please do not smoke, use smokeless tobacco, or drink alcohol the night before your surgery. And do not take any medications the morning of surgery unless directed by your physician or as instructed by your pre-admission testing department. If you have a CPAP machine, these are for patients with sleep apnea, please bring it in. You will need it. Now, if you have purchased an ice machine, we do also ask that you bring it in because we will help you set it up. Now, if you are bringing in a used ice machine, we do request that you purchase a new ice pad to prevent infection. Please bring the pad unopened in its own packaging. Most patients do purchase their ice machine and or new pad from their surgeon's office. It tends to be cheaper there. I do have a suggestion. Those machines do take a lot of ice to run them. So I recommend freezing 8 16-ounce water bottles in the freezer. So when you get home after surgery, instead of using ice, you can use 4 frozen water bottles at a time. And when they thaw, then you would exchange them. Here are some things that you might want to bring to the hospital. Of course, you can bring anything that brings you comfort, like your luggage bag. Please bring rubber-soled or non-skid shoes that you can slip on. Lace-up shoes will be difficult to put on after surgery. Please bring loose-fitting or comfortable clothing for discharge, such as elastic waistband shorts, sweatpants, and a loose-fitting t-shirt. If you have dentures, hearing aids, and glasses, please bring them. Now you can bring your personal toiletries if you wish, but we do have many items available for your use, such as a toothbrush, toothpaste, and deodorant. Please bring a list of your current medications, including the doses and times that they are taken. Please bring your insurance card, prescription card, picture ID, and a form of payment if you wish to use our in-hospital pharmacy for discharge prescriptions. You may also want to bring your electronic devices, as we do have free Wi-Fi available, but please bring your charging cords. Also, we will request a copy of your advance directive, such as a living will or durable power of attorney. Please know that jewelry and body piercings must be removed before surgery, so it might be best to leave these items at home. We are not responsible for lost items. Okay, now we are on our second part of our class, where we're going to talk about the operative and inpatient phase. This is what to expect the day of surgery and during your hospital stay. When you arrive at the hospital, you want to arrive at your arrival time. This is typically 1.5 or 2 hours before your surgery. And this is important because we need this time to help you get ready for surgery. Once you're in the building, please report to the surgery registration desk, but please pay attention to the location of your surgery, as we do have 2 separate ORs in the hospital. We have a main surgery and an ambulatory surgery center. Don't worry, if you get lost, just check in with the front desk clerk and they'll get you to where you need to go. Now, once you're registered, we will take you back to the pre-op area. This is where you'll meet your anesthesia team and surgeon. Your nurse will start your IV, obtain your medical history, check your vital signs, review your surgical consent, and H&P. We may pre-medicate you in the pre-op area with an antibiotic, anti-nausea, and some pain medication. Now, we are going to talk a little bit about anesthesia in the next coming slides, but you will be offered a general anesthesia, and depending on the surgeon and anesthesiologist, we may also offer you a local anesthesia block to help control pain after surgery. Most surgeries last about 1.5 hours to 2 hours long. Your surgeon will update your support person after your surgery is complete. Once your surgery is done, we will send you to the PACU or the recovery room, and this is where you'll wake up from anesthesia. We will be monitoring you closely. After your recovery, we will then transfer you to your hospital room on the orthopedic unit. Now, please note that we are a very busy unit, and sometimes it takes a while to discharge our other patients and clean those rooms. Please be patient with us. We work really hard to get our rooms for all of our surgical patients quickly. Most of our shoulder surgery patients receive a general anesthesia with a pre-op anesthesia block called an interscalene block. An interscalene block will numb your arm and shoulder to block pain for several hours after surgery. An interscalene block may not be a great option for patients with severe lung disease, as this block can cause some mild respiratory difficulties that can be worsened with lung disease. Your anesthesiologist will discuss your anesthesia plan with you on the day of surgery. What is general anesthesia? General anesthesia is where we put you in a deep sleep during surgery. It acts mostly on your brain and nervous system and affects your entire body. Now, during your surgery, you will have a breathing tube placed to help you breathe. Don't worry, it'll be taken out before you wake up. In the OR, you will also receive sedation, pain medication, and anesthesia gases. Now, some people may experience nausea, vomiting, sore throat, muscle aches, dry mouth, dizziness, and feeling really drowsy after anesthesia. But if you've had problems with anesthesia in the past, please let our providers know, and our doctor can make a plan appropriate for you. This information is for patients who know they are scheduled for same-day surgery and are not planning on staying overnight. So after surgery, you will be staying in our surgery center and you will not go to our inpatient unit. After you have woken up from anesthesia, your family member will be allowed to stay with you in the recovery room, but this is subject to change with hospital policy. Typically, most surgery patients spend about 2 to 3 hours in the recovery room. Once you are medically stable, you can be discharged. Please pack an overnight bag in case of an unplanned admission. If you have questions about this, please speak to your surgeon or your nurse navigator. Here's a few things to expect while you're here at the hospital. 1, you might have to have blood drawn during your stay. Our staff will be visiting you frequently to make sure that you're doing okay, and we'll be checking your vital signs and dressing often. Please use your call bell anytime you need anything or need assistance. And you will be asked to wear SCD pumps on your lower legs, which acts like a massage wrap to help prevent blood clots. You will also be asked to wear compression stockings, which by the way are provided by the hospital to help improve circulation. You may also need antibiotics after surgery to help prevent infection, but usually this is just given to you while you're at the hospital, and most patients are not discharged with a prescription for antibiotics. You may also have to wear oxygen to help you with your breathing, and you may need IV fluids, but this all depends on your needs. Here's a few of the things that you might want to expect during your stay during your admission. Now, we will help you use your ice machine if you purchased one, or we will help you get ice packs to use to help reduce pain and swelling at your operative site. Now, most of the dressings that we give you are waterproof, but the nursing staff will give you specific instructions on your dressing changes and your showering instructions after surgery. We will also have a meal service available to you during your stay, and you will be able to call in your meal order, or someone from our dining staff will assist you with ordering meals. Let's talk about pain control after surgery. This is a concern that a lot of patients have. But just so you know, we use a multimodal approach to help control pain after surgery. Our efforts to control your pain actually start when you arrive in the pre-op area, where our anesthesia team will start pain medication before and during your surgery. We may also offer you a local anesthesia block before or during your surgery to help control pain afterwards. We feel that pain control is very important to your success after surgery, so we will often ask you how your pain is doing, and we will ask you to rate your pain on a scale from 0 to 10, 0 being no pain and 10 being the worst pain imaginable. Please refer to the chart below. Now, we like to use a combination of medications and non-pharmaceutical methods to help optimize your pain control. It is expected to have some pain after surgery. I am not going to promise you that you won't have any pain, but it should be controlled to help keep you as comfortable as possible. Please know that pain medications are usually ordered as an as-needed basis, which means you must ask your nurse for pain medications while you're here in the hospital. Please let your nurse know if your pain control methods are not working for you or if you do not like the way they make you feel. Some pain medications can cause nausea, vomiting, and drowsiness. Now, typically, most surgical patients will be prescribed a pain pill to help control pain after surgery, and we recommend to take the lowest dose possible to manage your pain, as some pain pills can be habit-forming if taken unnecessarily. Some of our patients only need Tylenol after surgery. Now, we will say that most of the pain medications we prescribe do cause constipation, so we do recommend taking over-the-counter stool softeners such as Dulcolax, Senokot S, or Miralax, or the generic version of these, while you're on this medication. We also like to recommend non-pharmaceutical options to help control pain after surgery, such as rest, ice, ambulation, therapy, position changes, and meditation. During your hospital stay, you will notice that we are monitoring your blood sugar levels, and this is conducted by the means of a finger stick, starting after surgery based on your blood sugar in the recovery room. Now, if you are a diabetic, you are probably used to this, but we will still do this even if you are not a diabetic. And this is just to assist your body in healing, because we have found that having an increased blood sugar level immediately after surgery can decrease your body's ability to heal and make you susceptible to infection. So, if we find your blood sugar is elevated, even if you're not a diabetic, we may offer you or give you a little bit of insulin while you're here in the hospital. Again, this is just to minimize the risk of you getting infection. This does not mean you have diabetes. You will not be discharged with insulin. It just means that we want to make sure you have tight glucose control while you're here to reduce that risk of infection. Following joint surgery, you will be at higher risk for developing a blood clot in your legs. This is known as a deep venous thrombosis due to a lack of activity and movement. This can also potentially lead to a blood clot in the lungs, which would be an emergency, and this is called a pulmonary embolism or a PE, which can be life-threatening. The warning signs of having a blood clot would be sharp calf pain, tenderness or redness behind the calf or knee, or increased swelling of the thigh, calf, or foot. Warning signs of a pulmonary embolism would be sudden increased shortness of breath, sudden onset of chest pain, localized chest pain with coughing or taking a deep breath. This would be an emergency. You would need to call 911 or go to your ER if you have these symptoms. So to help prevent the formation of blood clot, we will be giving you those SCDs to massage your legs while you're here in the hospital. And we also want you to do ankle pumps to improve the blood circulation in your legs. And remember those stockings I talked about? Well, we do need you to wear them during your recovery for the first 2 weeks. Just during the daytime, take them off at night. I recommend to hand wash them and hang to dry. And then we'll also encourage you to walk often after discharge. We usually recommend 5 to 10 minutes of walking every hour that you're awake. Now, if you took blood thinners before surgery, you will most likely return to taking the same medications after surgery, but please follow your surgeon's recommendations. After surgery, you will be at high risk to develop respiratory complications such as pneumonia. So to help protect you from pneumonia, you'll be given a breathing device called an incentive spirometer. I affectionately call this a sucker. With this device, you'll be instructed to breathe in deeply and slowly about 10 times every couple hours while you're awake. This will help expand your lungs and prevent fluid buildup. You will also be encouraged to walk often and sit in a chair throughout the day to help improve your lung function. After surgery, you'll be at increased risk of falls because of the anesthesia, new medications, and just the basic impaired mobility of your new shoulder. So to help prevent falls while you're here, please remember the following. Do not get up by yourself. That's really important, especially those first 24 hours. Please use your call light whenever you need something or you want to get up. Make sure you change positions slowly and move carefully. And please wear some sort of non-skid socks, slippers, or shoes when you're walking or moving. We will also be utilizing bed and chair alarms to help notify the staff if you're getting out of bed without assistance. Now, in many cases, most patients will not be working with physical therapy until at least a couple weeks after surgery. Your surgeon will let you know when you should start physical therapy at your first post-op visit, although some patients may work with physical therapy in the hospital to assess their independence with walking and determine if they need to use a cane for support. We do encourage you to walk often after surgery as walking helps prevent pneumonia, blood clots, and constipation. Please do not participate in high impact exercises such as running or biking. Now, you may be given a list of exercises to do after surgery by your surgeon. Please do them. We will also ask you to wear a shoulder immobilizer or a sling at all times after surgery with no motion at the shoulder except for therapy and bathing. You will not be able to lift anything with that arm for many weeks. Please continue to do range of motion exercises on your elbow, wrist, and hand after surgery. Occupational therapy. Now, you may work with our occupational therapist while you're here at the hospital, but not always.
The goals of occupational therapy is to maximize your functional independence with activities of daily living, also to help ensure that you are performing your range of motion exercises appropriately. Patients will also have the opportunity to review and discuss therapeutic strategies for bathing, dressing, toileting, adaptive equipment for bathing and dressing, and durable medical equipment needs for the home.
Next, we're going to talk about our discharge recovery phase. This is what to expect when preparing for discharge and your return to home. A discharge planner, such as a nurse or a social worker, will meet with you to help discuss the plans for your discharge from the hospital. We will review your plans for going home, but most patients do not need home therapy. If home therapy is recommended, our discharge planners will review options for providers and help arrange visits to your home. If you need a medical equipment, we can arrange for purchase through our in-hospital supply company, although you will have the option to purchase these items elsewhere if you desire. When you are doing well medically, then you'll be ready for discharge. We typically discharge our overnight patients in the late morning on the day after surgery, but there can be delays based on your circumstances. Typically, your orthopedic surgeon or your PA and nurse practitioner will come see you in the morning and let you know when you're ready to go home. The team will prepare your discharge complete with instructions and prescriptions. Your nurse will review your instructions at discharge, and please do not hesitate to ask questions about any of the instructions or medications. We highly encourage your caregiver to be present during the discharge education. Also at discharge, we will review your dressing changes and when you can resume your home medications. We now offer a convenient program through our in-house pharmacy to fill your discharge prescriptions and have them delivered before you leave the hospital. They will run your prescriptions through your insurance, but please note that they will be unable to bill your prescriptions to your hospital bill, so your co-payment is due upon delivery. They do take credit cards and cash payments. If you wish to use your own local pharmacy instead, just let your discharge provider know. After surgery, it is important to inform your doctors if you have any questions or concerns after discharge. Here are some things that you should monitor after your surgery. If you have a fever greater than 101, shaking or chills, or if your extremity becomes pale, cool, or numb. We also want to know if you have uncontrolled pain unrelated by medication, rest, and ice, or if you have increasing redness, tenderness, or swelling at the surgery site, or pus-like drainage or excessive drainage. We also want to know if your incision opens or you have excessive leg swelling or sharp calf pain that doesn't go away. We also want to know if you fall. We also want to know if you need a medication refill, but just so you know, this is only done during normal business hours. And please call the doctor if you have any other concerns. Of course, if you have an emergency like chest pain, shortness of breath, or pass out, please go to the emergency room. To help reduce pain and swelling after surgery, we recommend ice. Please follow your surgeon's recommendations regarding icing, as everyone has different recommendations, but a good rule of thumb is 20 minutes to every hour in the first 48 hours and then 4 times a day afterwards. Be sure to use a barrier such as a pillowcase between the ice and your skin to prevent frostbite. We also encourage you to elevate. You will need to support your arm and elbow with a pillow when resting, and please follow your surgeon's instructions regarding your arm position in your sling. Now, once you are home, remember to take your pain medication as prescribed and as needed to help control your pain. Due to state regulations, we will only be able to give you a week's worth of pain medication at a time, so please call your surgeon's office if a refill is necessary. Now, as your pain improves, you can wean off your narcotic pain medication and take Tylenol instead. Now, some narcotics do contain Tylenol or acetaminophen products, so please do not exceed taking over 4,000 milligrams of acetaminophen products in 24 hours. Please remember to take a stool softener and possibly a laxative to help prevent constipation. Please be mindful of the vehicle you will be going home in after discharge. A small car may not be very comfortable for you, and a large truck may be too difficult to get into. Now, please ensure that your support person will be available to you after surgery. We do encourage your caregiver or caregivers to be present during your discharge education, as we want to make sure they are comfortable to care for you at home. Now, are going to ask you to do a lot of different things during your recovery, but the most important thing to do is to rest and relax. This will help your body recover from surgery and allow your joint to heal. Please do not overdo it when you get home. Avoid heavy chores like yard work and shoveling snow. There is a strong association with bacteria in the mouth infecting your new implant with dental work and cleanings. So to prevent infection in your new implant, please inform your dentist and other medical providers that you just had a total joint replacement. You will be asked to take antibiotics prior to any dental work. Please call your surgeon's office for your prescription of antibiotics prior to any dental visit. Typically, you will take a dose of antibiotics 1 hour prior to the appointment. It will be important to maintain good dental health before and after surgery, and please promptly take care of dental cavities, especially before surgery. It is also not recommended to schedule any routine dental appointments or cleanings for at least 12 weeks after surgery. So if you are due for a routine cleaning, I recommend that you either push it back or get it done before surgery. After surgery, it could be several weeks before you can start driving again. So please do not drive while you are taking narcotic pain medications and are in the sling. Driving after surgery is a decision made by your surgeon and yourself. And please remember you are the one that's ultimately responsible behind the wheel, and it is your job to be a safe driver, especially after surgery. All right, let's just do a quick recap of all the highlights. Please be sure to see your primary care physician and get your labs done before surgery. Not having these done will postpone your surgery. Make sure you plan to have a support person for after surgery. Make sure you know that there are 5 showers that you must do with the antimicrobial soap. Please follow your strict instructions for drinking and eating before surgery. If you have a CPAP machine and ice machine, please bring it in. If your ice pad is used, please purchase a new pad and packaging. This is to protect your incision from infection. Please bring an accurate medication list with you. This should include the name, dose, and frequency of the medications you take. And if you stay in the hospital overnight, please have your caregiver arrive the next morning to review instructions with you. We appreciate the opportunity to be your provider of choice for this surgery. Please let us know if you have any questions or concerns regarding your care or experience. Below are some of the numbers of our team members, and we are happy to help in any way possible. You may also contact your surgeon's office. Thank you so much for listening to our total joint replacement class. If you should have any questions, feel free to reach out to your team. We are always happy to help.